This week, lawmakers heard from the FDA about the vaping health crisis that has killed at least 10 people and hospitalized hundreds more. So far, the CDC says 16% of victims are under 18. Raquel Martin has more.
They are big tobacco in disguise.
As a vaping health crisis sweeps the nation, Dr. Lee Norman, the head of the Kansas Public Health Department, says the vaping industry is being put on notice.
There's going to be a lot of changes in their industry.
Wednesday, as Juul, the leading e-cigarette company, announced the resignation of their CEO and plans to pull all ads in the U.S., Dr. Norman joined a panel of experts urging Congress to pass more regulations to ensure no other vaping company can market their highly addictive products to kids.
Vaping is effectively showing them the way to nicotine use and addiction.
It's been heartbreaking to speak to families of young people who were otherwise healthy and are now barely clinging to life.
Janae Calden heads Michigan's Public Health Department. She says even though states like hers are temporarily banning flavored vaping products, a national ban would be more effective.
We need strong regulatory oversight over e-cigarettes.
At the hearing, lawmakers pressed the head of the Food and Drug Administration to take firmer action. But the commissioner says it's important not to harm adult smokers dependent on flavored products.
Some small off-ramp to allow addicted adult smokers to transition from combustible cigarettes to another product is of public health value.
He says the agency is working to strike a balance, but to expect the nationwide flavored vaping product ban to go into effect in the coming weeks. In Washington, Raquel Martin.
Now, Vermont has reported several vaping-related illnesses at last check, but doctors still cannot pinpoint what exactly is making people sick. I recently sat down with Vermont Health Commissioner Dr. Mark Levine to talk about this fairly new public health concern.
You know, when it comes to deadly overdoses, frankly, sometimes there is, a bad batch and there is an ingredient in this bad batch. Right. Do you think eventually it could come to that, or is it a wait and see?
Yeah, no, I think there's a distinct possibility. If you talk to our colleagues in New York State, one of the things that they're a bigger state, of course. They've had over 20 reports that they've been investigating. They found one of the more common elements was vitamin E, which was in the fluid as a thickening agent for this oily fluid. So their assumption was that vitamin E might play a distinct role. In the cases that have had either fluid from the lungs examined under the microscope or an actual biopsy of the lungs, some of those cases have what's called a lipoid pneumonia. And lipoid is like lipid, it's fatty, so a pneumonia that's related to a chemical inflammation from fatty substances, and vitamin E is one of those substances. The CDC has said that to date, that is not common enough in all of the cases that they've been investigating to single that out as the cause that nationwide is responsible. So we're still at that hypothesis framing stage where all hypotheses are valid till proven otherwise. They may actually be the right answer, but they have to be definitively shown to be the causative agent. And we're not there yet.
Are you hearing from doctors and providers that people are quitting? That enough people are quitting? Yeah,
I'm not hearing enough yet, but that would be very anecdotal. But I would love to hear that, to be honest. But we have to be sensitive about how challenging it is to quit. Because before all this erupted, I've talked to plenty of youth, both in high school and those who have now entered college. And especially the ones who entered college, they are very forthcoming with saying, I didn't know how addicting these can be. In fact, a third didn't even know there was nicotine in a Juul pod, for instance. So if I'd only, and they say, if I'd only known how addicting this would be, I would never have used it, because now here I am in college, or here I am at my job, post high school, and I can't get off of these things, and I'm very dependent on them, because they do have a very potent nicotine content. And as we're learning in this current epidemic, you can create the same potent level of THC that we do with nicotine and addict people to that, and they find that they're getting such a high level that it's challenging for them to get off. So I'm very sensitive to that, but my message is still, it would be prudent for anyone who's currently using these products to quit, because you just don't know what you're playing with. And if you haven't started, God forbid, don't start now. And there are plenty of aids to help you. If nicotine is an issue for you, see your healthcare provider, who has plenty of tools in their toolkit for helping people to get off of nicotine products. Use our Vermont 800 Quits website. Use our Vermont Quit line. And if you have a problem with cannabis, THC, there are numerous treatment providers throughout the state, and the list is on our website, that you can connect with to help you with that. Because that would be the most prudent thing you could do in a setting where you don't know if you're going to become the next person who comes down with this severe respiratory illness.
Doctor, if we could change gears just a
Sure.
bit. Recently in New Hampshire, the Sullivan County attorney had said bath salts supplanted opioids as the most serious threat to public safety.
Mm-hmm.
Are bath salts becoming an increasing issue in Vermont right now?
I do not see them as an increasing issue the way that you just described. I have to be frank that we're always on the lookout for the next issue, because people feel that, you know, the opioid crisis is still going to go on a while, but we're getting a better handle on things. We seem to have a little bit better outlook on the future, but everybody's always worried about what will happen next. Nobody imagined it would be a severe pulmonary illness from vaping, but at the same time, we're cautiously looking at usage rates of cocaine and other stimulant medications, because in other parts of the country, those actually are outnumbering opioids, akin to what the New Hampshire individual was talking about. In Vermont, we haven't seen that at this point in any consistent way.
What about your reaction to Purdue Pharma basically declaring bankruptcy?
Yeah, you know, that's something as a health commissioner I try to just learn about like anybody else in the public, speak with our legal counsel and our legal staff. The Attorney General of Vermont has already come out with his own statement about that, and I respect what he's doing in this enterprise. I think every situation is way more complicated than it looks on the surface, and as each day passes by, when I learn more about this, it's not so simple as saying they just declare bankruptcy and there'll be a certain number of millions and billions of dollars that will go. It turns out to be way more complicated than that in terms of where is all the money that the Sackler family amassed, and how much of it would be accessible to pay off all of these lawsuits across the country.
And something you and I had talked about before we started this interview, no new measles cases reported last week for the first time in 11 months. That has to be encouraging.
That's very encouraging. But a week does not make a trend, so I would love to see the second, third, fourth, etc. week go by. We're still not taking our eye off the ball. You know, we've done a lot of education and we've done a lot of strategizing with our schools and our school administrators, and have gotten tremendous cooperation from the education community, looking at students as they come into their schools and what their status is, and making sure that they're immunized appropriately. We've done a tremendous amount of quality control and quality improvement work with our clinical community, and pediatricians' offices are really very actively working with their families to make sure that students are all appropriately immunized, and children. And then lastly, informing the public and making things so transparent that the public can go to our website and learn about their own school and what the immunization rate is at that school, and can be vocal about it and work with the administrative staff in their school if they're not pleased with what they see.
Okay. Dr. Levine, appreciate you being here.
It's been a pleasure. Thank you.
We'll be right back on What Matters This Week.